Assalamualaikum and hello everyone. I'm Izati. As what required for my internship program, I need to present one case study in my intern place, which is in DEMC Shah Alam. The title for my case study is Newborn Diagnosed with Jaundice or Hyperbilirubemia with G6PD Deficiency in DEMC Shah Alam. Okay, firstly, let's start with aim for this case study. The aim for this case study is to investigate the relationship between hyperbilirubinemia in an infant with G6PD deficiency that may lead to jaundice. The next aim is to find the correlation between the serum bilirubin and liver dysfunction of an infant due to G6PD deficient. So here, our target is to understand the meaning of hyperbilirubinemia, also with G6PD deficiency, and also serum bilirubin. Next, we proceed to introduction. What is jaundice? I believe that everyone here is familiar about jaundice, but what is actually a jaundice? Jaundice is common illness that occurred in newborn babies as the infant's skin will appear like yellowish also together with their eyes. So basically when you see that newborn babies, their skin's a bit yellowish and the white of the eyes look a bit yellowish, maybe that baby are suffering jaundice. This symptom is due to high level of bilirubin in their bloodstream. It's normal for newborn to have jaundice, but if the bilirubin level remain high for a long time, it will cause a brain damage in an infant. Bilirubin is an important antioxidant circulating in biological system of neonate. However, high bilirubin levels can be toxic for CNS development and may cause behavioral and neurological impairment. So basically, yeah, it's normal for a newborn to have high bilirubin level because the liver capacity to break down the hemoglobin is quite low. But the problem is if it's remain for a long time, it will cause a big problem later on. So we will discuss later on in the case presentation. Next, G6PD deficient babies had higher peak total serum bilirubin levels, were more likely to require phototherapy or exchange transfusion. G6PD deficient baby had a higher mortality rate compared to non-G6PD deficient babies. Severe neonatal jaundice is highly associated with G6PD deficiency in infant as it interrupts the bilirubin production pathway. So here we want to investigate what's the relationship between G6PD deficiency babies together with the jaundice and liver dysfunction. We proceed to the case presentation. Here is the patient demographic for the patient. Alright, this is the patient laboratory data. We collect the biochem data and also their hematology test data. So here is the table 1, is the biochemistry results. So you can see from the table, there is day 1 until day 30. So we compare the serum bilirubin, total, direct, and also the serum enzyme for liver function test. Next is hematology test. Okay, hematology test, we provide the ABO and the rhesus for the both mother and infant blood type and also G6PD deficiency test. Here we can see that the G6PD deficiency is abnormal, but he's not as severe G6PD deficient. It's just that he is an intermediate G6PD deficiency patient. Alright. Next, in the case presentation, the important thing that we need to highlight is the patient's symptoms. The physician observe and monitor the patient, and the patient having these symptoms where the newborn baby appeared yellowish on his skin on his first day of his delivery. Next, after a few days, his white parts of the patient eyes look a bit yellow. The baby is not getting weak, yellowish green color stool, and the baby has a poor sucking for breastfeeding. Alright, right now we move to discussion. Alright, right now we move to discussion. From table 1, it can be seen that the newborn baby have high level of AST, ALT, and GGT on his first 24 hours and declining over time for AST measurement, proportional with level of ALT, which also decreasing over some period. In compare with AST to ALT level, it can be seen that AST has a higher value. AST and ALT are important indicators for liver disease, but to differentiate the causes for liver dysfunction, GGT is needed to confirm that is a liver problem. Liver dysfunction may be caused by hemolysis inside the liver. Increased rate of hemolysis over time lead to more serious complications. Hemolysis might occur when there are problem in production of bilirubin and the breakdown process is interrupted. As shown in table 1, the total bilirubin exceed from normal range from day 1 until day 7 started to be a normal range after day 7. It showed that the infant had improved his liver function to break down the bilirubin excrete to waste products. That is normal for a newborn baby to have difficulty to break down the bilirubin, but too much bilirubin is produced, it can lead to more severe complications. Example of the complications are kernicterus and hearing loss. Total bilirubin and direct bilirubin level is the main reasons for jaundice. Bilirubin give yellow color on the baby's skin. Patients with G6PD deficient tend to produce more bilirubin in the liver, thus it can lead to hyperbilirubinemia, as or known as G6PD jaundice. So we go to the table 2. It illustrates that the infant is an intermediate G6PD, so it can be concluded that G6PD deficient is one of the factors that causes the jaundice, because as we know, jaundice is multifactorial disease. G6PD deficiency can increase bilirubin production by causing hemolysis in liver that resulting in increased serum free hemoglobin, which is metabolized to produce more bilirubin. Based on table 2, the G6PD deficiency test is tested together with ABO and the rhesus. This test is important to identify the major cause of jaundice, as jaundice is multifactorial disease. Most ABO and rhesus incompatibility hemolysis jaundice occurs when the mother has O negative blood and the baby is a rhesus positive. But in this case, both mother and baby have a A positive blood group, thus is not the main cause for jaundice. Last but not least, we need a So as a conclusion, G6PD deficiency is one of the factors causing neonatal jaundice. It is considered an important risk factor for severe neonatal jaundice, which may result in kernicterus. In infants with G6PD deficiency, management of neonatal jaundice should be hastened to avoid irreversible neurological complication. G6PD deficiency causing high bilirubin production in liver and disrupt the liver function. Further studies are required to evaluate the relationship between the G6PD enzyme level and the severity of neonatal jaundice. This list is a reference that I refer to for presenting and take the point for my case study. So thank you.